most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
We're
therapist.
the most famous physical therapists on the internet.
In our opinion, of course,
You have
Bob.
a stiff neck or headaches, try this quick fix by physical therapy.
There
Physical
you go.
therapist, I should say. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, you're going to want to join us on our social media channels, especially go to our website, bobandbrad.com, because we're giving away a big gift this week. We're giving away a Teeter Inversion Table.
Right.
So
and there, it's a nice table. I really like it.
Yeah, if you're having trouble with your back and want to get some of that decompression, this is the baby to check out. You can also find it pinned to the top of our page on Bob and Brad, Facebook, and we have a short version of us on Instagram and Twitter if you want to join us there. So
excellent, Bob.
All right, so we're talking about stiff neck, headaches. A lot of times, headaches can be actually coming from your neck. Okay, and let's talk about that, Brad. Let's talk about what kind of headache comes from your neck.
We got Sam here, by the way.
Sam here, yep. And if you look at right between the first vertebrae and the second, C1 and C2, there's a nerve that comes out from underneath, between those two, and it goes right up into the skull, and it comes around and into right about by the eye. It's a sensory nerve.
Right. Sometimes they call that headache when you get like that, they call it a full wrap.
A full wrap, yeah. And so, it's the side of your head, and it's the greater occipital nerve, by the way. That's the nerve that we're talking about here.
Greater occipital.
Yeah.
There you go.
As opposed to the lesser occipital. But anyway, quite often, what is it caused by, Brad?
Posture.
Poor posture.
Head forward posture.
Especially the head forward posture. The other thing that's, so we're going to show you a quick fix to try to help correct that and give a little manual assist to it also. But in addition to that, we want to try to loosen the neck up a lot of times. A lot of times your rotation is affected at C1 and C2 or C3 even.
Yep.
So we want to work on that. And we want to make sure overall your neck is loosened up, because it generally the more motion, less pain.
Right.
So
all right,
let's get to it. All right, the first one we're going to do, now we've shown this many times, but we're going to show a little variation of it, is a chin tuck. So Brad, if you want to show the side view.
Sure.
So this serves two things. One, it corrects your posture, because this is the head forward posture. By doing this, now this is causing tension in that area up here, that suboccipital area, squishing down over that nerve. So by correcting, Brad, if you want to correct.
Yeah, so the first, you have to get everything down here up tall too. Yeah. So it's up, and then we're going to chin tuck, not down, but back like this.
It's a good point you made about posture, Brad, because if you correct it like this and you try to correct, it's not doing it.
Yeah, things jam up. It's just not the way we're meant to be.
So again, we've shown these chin tucks many times. Great to do in the car, or you can do them, when you're at the desk. But a nice little adjunct to it is if you actually add a manual component, what we call give a little overpressure.
Right.
So you can use the little crux of your thumb here, and you can put it right over your chin and give a little overpressure. Now, this should be pain-free. We never want to have increased pain, but give a little overpressure, and you're going to, I think most people like the feeling of this, Brad.
Right. You should feel a little stretch right back in here. If you do, you're doing it properly, and you got some tight muscles back there. And so we just do the pressure on, pressure off. You can do it 3 to 5 times. If you wanted to go up to 10, that's fine. Probably not while you're driving.
And you can do this throughout the day. I mean, you can do this every hour if you want. As long, again, it's not increasing your pain. You're not going to increase soreness. I mean, it's...
And this can actually, if you have a headache that's doing this and you're doing these properly, I've had people, as a matter of fact, I had someone at a presentation, I had someone come up from the audience. I was kind of rolling the dice. I said,
"Come up." Rolling the dice.
She came up and she started doing these, and her headache went away right there. And that can happen. It doesn't happen all the time, but it can. I've had it with patients too.
It hasn't happened with me. I don't get headaches very often at all, but the few times I've gotten one, once it got fired up, it got fired up. I mean, it helped. I didn't have it the next day, and it didn't come back.
Sure.
But it just seemed like. sometimes I think you just take that ice pack and put it back there
Sure.
too. So
Can we show them one supine with
yeah,
the towel roll?
yeah, absolutely, Brad.
So this can work out nice.
This is a variation of it.
Yep. Take a towel roll, put it here, and then put the towel roll right on that. I think that's called the inion, that pointy part on the back of your head, the bone. So it's
Well,
right
that's
there.
pretty impressive, Brad. Remember that?
Not here. I remember it because I used to call it the onion, but it's not the onion. It's Indian, I believe is how you pronounce it. That's a long time ago from school. But this allows a gap here where it needs it.
You
And
gotta
then,
watch your glasses are.
oh,
a
yeah.
little wild
Take
there.
your glasses. No wonder I could have issues there.
Yeah.
There, that's much better. Thank you. And then this just makes it easier. You can relax very much while you're laying down, breathe, relax. And
This is nice for people who don't really understand how to do a chin tuck either.
Yep.
Sometimes it's a great way to instruct them on how to do it. It just makes it a lot easier.
sure.
All right, another one. These are really not a quick fix, it's quick fixes. And you have to figure out which ones work for you.
Yep.
Those are the ones you do. Don't do all of them. You don't need to do all of them.
Right.
But sometimes people just take their fingers and do some rotational massage here, do some circular motion here, and they also do little splaying. So they'll put their fingers together and they'll split them apart like this. And this really feels good, especially if you are having a headache. And even if you're not having a headache.
I'm
it's
telling
just-
you, Bob,
yeah.
this is feeling good without a headache.
Right. Along with that, a lot of times people's rotations are lacking, especially with stiff necks. If you want to increase your rotation of the cervical spine or the neck, a lot of emotion comes from right underneath the skull here. So if you turn to the left, you just can kind of grab on the right side here and turn to the left, and it'll help facilitate it. And if you're going to turn to the right, you're going to grab on the left side right here below the neck and give a little push. Now, again, this should be pain-free. I don't want to increase pain.
Should
But
feel good.
It should feel good.
Like a good
Right.
I'm telling you, Bob, this is one for particularly of us who are getting to our middle age and our senior years. People always, it seems like, lose range of motion with rotation.
Right.
People in their 60s, 70s, it's like, can you rotate? And it's I can't think of a time where it's
So we're going to
not
live to
limited.
120 or what?
20,
We're
121.
middle age.
Yeah.
So, and another good one, just a good stretch for overall neck motion or cervical motion is, and I like to do this. You just grab onto your traps like this, your
Mhm, yeah.
traps, and you're going to bend back like this. Now you can do this with a towel too, but this just feels good, and you can even give a little massage while you're doing it.
Oh, yeah. Wow.
Brad's going to show with a towel because
Yeah.
it really does work well with a towel too.
Yeah.
To be honest,
Like
sometimes it's even easier than to
Yeah.
do it that
You
way.
get some, and all these should feel good. It should feel get you relaxed. If it does create pain, there may be another issue, and that needs to be addressed.
Yeah, pick among these and see which one works for you, and apply it to your life, and let us know if it worked for you. We like to hear comments, don't
That's
we?
exactly.
We don't
do.
like to hear comments. We like to see comments.
Yeah, we read
have
them.
to read them.
Yeah, there you go.
So, all right. Thanks everybody for watching.